Now let's take a look at electronic medical records use around the world. Okay, we're going to take a look around the world. We're going to look at which practices are computer-based, and of those practices that are computer-based, what percentage use electronic medical records, okay? So in Australia, we have 90% of the medical practices are computer-based, and 53% of those practices use electronic medical records. Next, we have Denmark. 95% of the medical practices are computer-based. 62% of those use some form of electronic medical record system. Netherlands. 95% of the medical practices in the Netherlands are computer-based, and 88% of those practices use electronic medical records. Sweden. 95% of the medical practices are computer-based, and just about all of them, 90%, use electronic medical records. England. 95% of the medical practices are computer-based, and 58% of those practices use some form of electronic medical records. Now let's take a look at the breakdown by function. Why do these medical practices use electronic medical records? For what purpose? So let's first take a look at Australia. Again, 90% of those using electronic medical records in Australia use it as follows. For prescriptions, 100% of that 90% use it for prescriptions. Okay, in Australia, we don't know the exact number of medical practices that use it for notes and reminders. 15% use it for clinical vocabulary. And we don't know the exact number of medical practices that use it specifically for going paperless. Okay. In contrast, let's take a look at the United Kingdom. 99% of the medical practices that use EMR. In the United Kingdom, 80% of those practices use it for prescriptions. 45% of those practices use it for medical notes. 70% of those practices use it for reminders. 100% of those practices use it for clinical vocabulary. And 45% use it for going paperless. Now this might be, the United Kingdom's percentages might be reflective of the $2 billion initiative to get all physicians online. Because if you'll take a look, you'll notice that the electronic medical records in the United Kingdom are applied across a lot more functions, are used for a lot more functions than they are in Australia. Now, what is an electronic medical records? So, at the core, EMRs are just a database. The database can hold many kinds of information, coded and not coded. The database can be organized by date, time, and patient ID. And it'll typically contain the patient's registration data, which will be typically the name, the contact info, the date of birth, social security number, etc. It'll typically include the test results, lab tests, radiology tests, nuclear medications, etc. It'll typically include a history of the medications, the active medications, and then a history of the inactive medications and the allergies. It'll usually include a current list of diagnoses and problems. It'll include appointment data, clinical notes, and billing information. That's basically what EMRs contain in a nutshell. Okay, so we can assume for each patient there will be a specific file. In that file, you'll have just about everything you need to know about the patient. So the question is, if an EMR is just a database, how is it different from any other database? How is it different from Microsoft Access? And why is it so useful? So the answer to that is that there are a lot of value-added components in an EMR. Okay, the first thing is a clinical knowledge hierarchy. How do clinical concepts work together? In addition, it'll include a list of current clinical recommendations, which you won't have in Microsoft Access. It'll include a list of appropriate medication indications, doses, adverse effects, interactions, and cost estimates. And another value-added component will be the costs, the indications, and utility of tests. Now, what are some typical EMR components? So first of all, we have lab systems. Okay, the lab systems will typically include all lab tests ordered and the results, and they'll be stored as coded results in most systems. In addition, they'll have radiology systems. It'll typically store the test reports. Next, there's a pharmacy system in most EMRs. It'll typically list all the current medications, the inactive medications, and when they were last dispensed and ordered. Another component is the billing system. It'll have a list of the diagnostic codes used for billing. And then they'll typically have the registration system, the names, the contact info, and the personal info, etc., for all the medical practices patients. In addition, most EMRs will have an order entry system. This is where physicians will enter the orders, the prescriptions, and the notes, etc. online. They'll typically have a decision support system. Now, these are usually linked to the order entry system, and they assist in providing guidance at the point of care. And it'll typically contain a database for clinical knowledge guidelines, list of medication indications and doses, etc.